All right, so the first one, let me show you. It's gonna look like this. You're on your hands and knees. You're gonna have your tailbone or your butt to touch your heels first. All right. Now, when you're in this position, this is called a cat camel. All right. So you're gonna bring that part of your back up and then down. Okay. So it's just gentle motions. Don't worry about going to the end ranges or anything like that. Just gentle motions is fine. This is variation number 1. And variation number 2, toes up, and then the butt gets a little bit further. Okay. And then this is number 2. Okay?
Gotcha.
Now the reason being when we go from butt to here is the butt one locks out your lower back.
Okay.
So that's going to make it feel a little bit better. And it works on mobility on the upper part of your back.
Okay.
All right, so we're isolating that. Same exercise, now that we're here, now we're working through full mobility in both the lumbar and the thoracic spine.
Okay.
Okay? Okay, let me see that.
So first one.
Yeah, try to get your butt down. Yep. And you can relax this too, so you can have it bend a little bit more.
Okay.
Yeah. And that might actually make it feel a little bit better, just like we talked about, right?
Just want me to.
Yep. Push up here. And yeah, you got it. So let's do 10 of those. That's 1, 2. Good. 3. And try to focus more motion just in this upper part, okay? 4. Good. 5. Head could go down when you, yep, and then head goes up. There you go. 6. Yep. 7. Looks good. 8. And if you want to make it a little bit more, you can also breathe in. Like take a deep breath when you're curled forward. So curl forward first. Take a deep breath. That's going to help expand it more and breathe exactly. And try that one more time. Good. Perfect. All right. Any pain with that?
No.
All right.
No.
Let's go part B.
This one, same thing.
Same thing, but now we're trying to move through the whole back. So you're still moving just here. Yeah. And then especially when you go down, because remember how we talked about extending your back makes on the pain? Go where you feel pain-free.
Okay.
Okay? Yep. Move through the whole back and through the back. Good. Good. And same thing, you can breathe, take a deep breath in when you curl forward. Good. And as you continue to do this every day, if you feel like you can go into the more extreme ranges or get more range of motion in this, feel free to do that. Okay. But at least for today, tomorrow, and maybe the next day, just stay within the middle part and no need to go the full arch hard and bend hard kind of thing, okay? Okay, good. Good. How's that feel?
Feels good.
Feels good? All right. Let's have you stand up one more time just to make sure everything is all good.
Okay.
All right. Hands behind your back. And then go ahead and arch again.
Yeah.
All right.
Good.
All right. Any pain with that?
No.
No pain at all. All right. Pretty good. Standing
Standing feels fine.
feels good.
Yeah.
And then let's see you rotate again. Just want to make sure everything is all checked out there.
That feels good.
Perfect. Perfect. All right. So that's a great exercise. It seemed like it really helped you, get from that little bit to nothing. So awesome. Okay, last one. I want to capitalize on this part of your back.
Okay.
Okay. Especially because we are rotating and you really want to get back into golf.
Yeah.
You need more mobility in that area, and I'm very surprised that you went through this long golfing with such a stiff back.
Yeah.
So we want to get that rotation mobility a little bit, okay?
Okay.
All right, so let me show you how this works. So you're going to be on your side, all right? You're going to bring both knees to your chest. Grab the top knee, right, with the bottom hand. Hand behind your head. And you're just going to rotate back.
Okay.
Okay? Forward and then back.
Okay.
All right, try that.
Here.
Yep.
Here.
Hand behind your head.
Just
Good. Yeah, and then let me give you a little bit of a pillow here. Yep. Yeah. Good. And you should feel a rotational stretch kind of in that top part of your back. Now what you can do is same thing. Remember how when you get to that end range, take a deep breath. And then forward. There you go. Back. Good. And I like how you're keeping both knees on the ground, because sometimes when people rotate, they'll rotate their legs up with them. But I like how you keep it on the ground, so that's awesome. All right, let's do one more and then switch sides. Good. Yep. Yep. Rotate. Deep breath. And relax. Yeah. All right. One more. Perfect. Perfect. Okay. Looks good?
Yeah.
All right. Okay. So I want to see you maybe if you can schedule in for next week, that would be great.
Okay.
Those exercises, remember we have two, but then the first one has like part A, part B.
Yeah.
Right? With the butt down and then the butt a little bit higher. And then the second one is your rotation.
Okay.
Try to do that every day if you can, right? You could probably do sets of 10 today, or since you did 10 today, let's just stick with that.
Okay.
But about 2 to 3 sets of 10 every single day if you can.
So like 20 to 30 at the end of the day.
Correct. Yeah, and if you can do that all at one time, you can split it up, breakfast, lunch, dinner, or anything like that.
Okay.
You are retired, so of course we have a little
Have
bit
the time.
more time.
Yeah.
Yep. Yeah. So do you have any questions for me?
No,
Anything that you're confused about?
No, I think, do you think it'll ever happen again?
It might come back, but because we're getting a little bit more mobility, that is going to help you out a lot.
Okay.
Now, we want to work on some flexibility on some other areas and then maybe some strength as well to help you get stronger. But I didn't really look at the strength of your core and stuff today, but that's something we can definitely look at next time to make sure that you have the stability and I guess backup. So that if anything happens, you have like a fail safe to like, hey, don't go that far.
Gotcha.
And then so that you won't feel that pain again.
Okay.
Okay?
Cool.
All right, cool. I'll see you in a week. The front desk will help you out, okay?
Awesome.
All
Thank
right.
you.
Thank you.